some of the biggest shifts have been in how I am with myself. I used to have such a harsh critic, which I now understand. Like, she was there to protect me, because if she could criticize me before others could, it would protect me from other people's shame. But I've been able to largely replace that voice with a much more gentle voice. And before, that was utterly inaccessible to me.
When we talk about neurodivergence, outdated stereotypes often overshadow the diverse reality of how it presents in different people. How do these misconceptions impact diagnosis, treatment, and self-discovery? What does truly neurodiversity-affirming mental health care look like? Dr. Anna Neff, clinical psychologist, author of Self-Care for Autistic People, and host of the Neurodivergent Conversations podcast, joins us to challenge stereotypes and explore paths to more inclusive understanding and support. That's straight ahead on episode 247. I'm Emily Kircher-Morris, and this is the Neurodiversity Podcast.
What is neurodiversity?
You see the world differently.
Autism spectrum.
Gifted.
Complexities that are inherently inside.
ADHD.
Dysgraphia.
Tourette's.
All brains are different.
You are exactly what this world needs.
This is the
Neurodiversity
Podcast.
If you're looking for a community of people who are all about promoting neurodiversity-affirming practices throughout the world, I would love for you to come and join us in our Facebook group. The Neurodiversity Podcast Advocacy and Support Group is a place where parents, educators, clinicians, and neurodivergent people converge to share conversations and make connections with others who see how the small steps they take can change the world. It's a drama-free zone, which I love, with members who really care about offering ideas and support. It's also the place where we get the questions for our AMA episodes, one of which is coming your way very soon. So hop on over to Facebook and search for the Neurodiversity Podcast Advocacy and Support Group. We'll put a link in the show notes. I'd love to meet you there. Okay, my conversation with Dr. Anna Neff is here next.
previously on the Neurodiversity Podcast.
It's not just the accountability piece. I think kids build self-esteem from being accountable and successful when they do things independently. And I think sometimes when we swoop in to save them, we steal their self-esteem a little bit. Mm-hmm. And that, I think, is can become a slow development of learned helplessness. And I completely do not think the intention is negative from parents at all. It's not malintended. It's meant to be helpful. But going back to just like your physical muscles, you have to let your children exercise those executive functioning muscles, even if it doesn't always work out.
That's episode 222. Find it wherever you get your podcasts.
Today, I'm welcoming Dr. Anna Neff to the podcast. Anna is a clinical psychologist and author of Self-Care for Autistic People. She also has an upcoming book on autistic burnout, and you may know her from her Neurodivergent Insights Instagram social media feed. So, Anna, thank you so much for joining me.
Absolutely. Thank you so much for having me, Emily.
One of the things that keeps coming up over and over in the conversation about neurodiversity is this idea that many people, from medical practitioners to educators to the general public, have stereotypes of what a neurodivergent person looks like. But these ideas are outdated and actively cause harm to many of the people who don't fit those stereotypes. So maybe that means that they aren't getting diagnosed, or maybe it feels like they have to have a lot of pressure to mask those traits of neurodivergence, or maybe they just don't even realize that they are neurodivergent. So I would love for you to share a little bit about what some of these presentations of neurodivergence are, and what are they that are getting overlooked, and why is that?
Really, most things outside of this stereotype are getting overlooked. And I think it might be a little bit easier to talk about demographics this is often happening in. We talk about the lost generation of autistic adults, and also there's a lost generation of ADHD adults. And there's a lot of reasons for that. For one, yes, the non-stereotypical presentation, and that might be due to masking or internalizing versus externalizing some of the experiences. But that also has to do with just the historical context we're in. And how the diagnostic criteria, especially around autism, has changed a lot. Like I grew up in the 80s and 90s. I wouldn't have met the criteria being used back then. So there's a lot of situational factors on top of presentations. But then also a lot of the research we have has been on kind of white, affluent, cis males. So outside of that demographic, people of color, women, genderqueer people, a lot of those experiences are less known about and therefore missed. But with that said, there's also plenty of cis white males who also mask and who also are missed. I know you work a lot in the 2E space. If someone is gifted and neurodivergent, they might be missed because they have ways that they're overcompensating. So there's really so many reasons that we've missed so many people. And I think the pain point there is then a lot of these folks are in therapy and they're getting treated and they're often having like what we might call resistant treatment depression. They're not getting better because a core piece of who they are is not being supported and it's not yet identified.
That reminds me of a client who I had. And I think it's always really important to recognize how much of an evolution this is, even for us as clinicians. Because when I came to this work, when I transitioned out of the schools and into my clinical practice, it was still when we had the diagnosis of Asperger's.
Mm-hmm.
The new DSM wasn't out yet, which was released in 2013, I think. I look back and realize that there were clients who I missed that neurodivergence.
Yeah.
I am reminded specifically of one particular client who, was a young girl, was in school, and had, just like you were talking about, that treatment-resistant depression. It was like they were trying medications, we were doing therapy, we were doing all of these things. And looking back, I realize she was probably autistic, but I just didn't know what those traits were in that context. And ultimately, she ended up moving schools for some various reasons, not related to that specifically, but just because of life circumstances. And ultimately, she found a couple of friends who she clicked with.
Yeah.
And her parents checked in with me, and all of a sudden it was like, oh yeah, her depression is gone. Well, she wasn't depressed. She was lonely.
Yeah.
And we can work on all of those things, and we can work on, but it's like, until she had that community, you can't think yourself out of that sort of thing.
Right, exactly. And it's such a core part of understanding self. I've kind of expanded the way I talk about this. I do talk a lot about non-stereotypical presentations, but also we're also missing stereotypical presentations. Like there's plenty of people making it to their 30s, 40s, who probably a lot of people in their life are saying like, oh, I think they're on the spectrum. They're using some of that kind of derogatory language. But they're also not getting identified or diagnosed. I think partly because the medical field historically, we've been, especially with autism, we've been really nervous about this diagnosis. We feel like we're giving someone really terrible news when we tell them they're autistic. And I remember that in my training of meeting with someone and diagnosing them with ADHD, but just feeling like there was something more and thinking like maybe this is autism, but I also don't know what I should be looking for. And if it is, I feel really anxious to broach that topic. Like it just is a topic that in culture has a lot of weight to it. And I think as mental health providers, there can be a lot of anxiety around that diagnosis specifically.
It sounds like we were maybe around the same age. And so, I was one of the girls who was diagnosed with ADHD back in the early 90s. And that was pretty rare. And it was before Asperger's at the time was even added to the DSM. So I couldn't have been assessed for or diagnosed with that because of the way that it was written in the previous DSM. And
right.
It's interesting to look back now and recognize those traits in myself, although I've never been formally given the diagnosis, and we could have a conversation about self-diagnosis. But I know that for you were diagnosed later in life. Can you just share a little bit about, from a self-awareness and an emotional perspective, what did that mean to you?
Yeah, and I kind of to wrap in self-identification, I also self-identified before I was medically diagnosed as autistic.
Right.
And for me, it was kind of that classic child to parent pipeline of the child is identified, and then and for me, it was seeing it in my daughter that, of course, opened up like, what does autism in girls look like? And that's when I came to discovery of myself. So there are kind of two seasons. I guess the first was my self-discovery, and then the formal kind of anointing of the diagnosis by a medical provider. I think my most powerful experience was in that first week, because I dove into all the research. Because I'm a psychologist, I actually had a lot of assessment data on myself, and I had taken assessments that had told me you should look into autism that I totally discounted before. Wow. And I had my IQ test, and I could look at my working memory. I could look at my processing speed. I could now understand these gaps I was seeing in my IQ. So within that first week, I remember I was sitting across the room from my spouse, and I said, I feel at peace in my body for the very first time. Mm-hmm. And it wasn't that my body was all of a sudden a marvelous, wonderful place to exist in, but it's that it made sense. It made sense why I was chronically low-grade dissociated, why the world constantly felt like it was intruding on me. I felt alignment for the first time. And so the chaos of not understanding my experience is what quieted down. And then from there, there's just been so much change that's happened. But I think some of the biggest shifts have been in how I am with myself. I used to have such a harsh critic, which I now understand, like she was there to protect me, because if she could criticize me before others could, it would protect me from other people's shame. But I've been able to largely replace that voice with a much more gentle voice. And before, that was utterly inaccessible to me. Mm-hmm. So yeah, it's had a really profound change of how I am with myself and how I experience my body and am with my body. Again, there's still lots of discomfort, but I'm with those experiences differently.
What I hear you saying, and what I feel like I hear a lot of people saying about their own experiences, is it gives you permission to feel those ways. Like previously, it's like, well, you shouldn't feel this particular way because other people don't, and you're just being too sensitive, or you're just being, whatever it might be.
Yeah, the math doesn't add up. Right. And that was actually part of, so I was working with a psychoanalytic therapist at the time because I was in my training. I was like, the way I'm emotionally moving through the world is like someone who's experienced trauma, but I don't have a memory of trauma in my childhood. And so there was this huge disconnect of I am privileged, I am chronically depressed, anxious, unable to be meaningfully engaged in my relationships. And that disconnect of why is this my experience? It doesn't make sense. Yeah, having those mysteries solved. And you're right, I see that too. I see that in the folks I work with. And it's such a powerful moment of like, actually this experience I'm having makes sense. There's a name for it.
There's also this aspect, like on the one hand, you have the medical community and the professional community that just kind of discounts and, doesn't look at some of those characteristics as far as a diagnosis goes. There's also this aspect where it's like you're willing to look at a diagnosis, but it gets misdiagnosed. Sometimes it's maybe something that's one neurodivergence for another, like, it looks like ADHD, but really it's autism, or maybe both. But it can also be some of these other less common diagnoses. Like, so for example, I often hear people talk about borderline personality disorder with autism. Can you talk a little bit about what some of those other types of overlaps are and why that's so hard for clinicians to tease out sometimes?
Diagnosis is, I think, tricky in general, right? It's not like a medical thing where you have a blood test. We would like to think that there's a lot of validity, right, across diagnoses, but so much of it does depend on the clinician and the narrative they have around the clustering of symptoms. If we think about I do find diagnoses very helpful. Mm-hmm. They're also to some degree social constructs of like, okay, when this clustering of symptoms and traits come together, this is what we call it. Not to say they're not real, but there's also an element of social construct on top of them.
Totally.
So that said, yeah, like BPD and autism, that's, I think, a really common misdiagnosis for especially autistic women and genderqueer people. Also, they can co-occur. Mm-hmm. So it's really complicated. A person can both be autistic and have BPD. And if we think about BPD as a vulnerable neurology in an invalidating environment, of course there's going to be a lot of autistic and ADHD people who develop that. So I'm not sure if this is what you were asking about, but like more specifically the overlap. One aspect of overlap might be, for example, heightened emotions. We know that regulating emotions is difficult in the context of BPD. Often it's rooted in an attachment injury, or that might be the trigger. But also for unsupported autistic people, it's difficult for us to regulate our emotions. And if we're sensory overloaded or having a sensory meltdown, that could get interpreted, especially if someone is like trained kind of in the framework of personality disorders and trauma. They might see that as a trauma response, or they might see that as emotional dysregulation. There's also a tendency to idealize and devalue in BPD, and to kind of have really all or nothing categorizations of relationships. If we think about autistic, all or nothing thinking, if a person becomes a special interest, that can look a lot like idealization. So there's, and I mean, honestly, I could go through all the BPD criteria. I don't think that's what you want me to do. But there is so many reasons that unsupported, undiagnosed autism could look like BPD. And again, it could actually be both. Mm-hmm. So that would just be one example. But I think we could go through several of the personality disorders and see similar things.
I think sometimes from my knowledge of this is that I think a lot of times maybe undiagnosed autistic women get the BPD label, and I feel like sometimes undiagnosed autistic men get the narcissism piece.
Yeah, no, I say the same thing. I think that's fair. Or the schizoid. Schizoid or yeah, I think NPD. Yep, BPD, NPD, and then like the other one, avoidant personality disorder. Mm-hmm. I think there's a lot happening there. There's also a lot of overlap with OCPD, obsessive compulsive personality disorder. Yeah, so in the DSM, like before you diagnose a personality disorder, you were supposed to rule out neurodevelopmental conditions. But there's this misperception out there that would have been caught in childhood. But we know we have this lost generation of autistic and ADHD adults. And so that is one thing I really wish training programs would start emphasizing is, again, before diagnosing this, rule out that this is not someone who's in that lost generation of autistic or ADHD adults.
Yeah, there's so much work to do to get professionals trained in a way that helps them understand. I know there's this pushback even. I have somebody who I know who's a professional in the field who basically will, say things like, well, the next person who comes in and tells me that they're neurodivergent and, but I think that's a perception that a lot of people have. There's this pushback, like I'm the expert and therefore.
I think we're in a really interesting cultural moment where there's this polarization that's happening on like social media awareness-driven platform. And then assessors, I think most of us who are in the profession have been in those Facebook groups where it's like, oh, these TikTok people coming in wanting autism assessments, eye roll. It's just really messy right now.
But like you said earlier, it's hard. We do some assessments at our office and have a psychologist who teases all of that stuff out. And there are times it can be really difficult. For example, what's anxiety versus ADHD? And you do a full eval and you really look at it, but it's complicated. It's complex.
It is. And I appreciate you naming that. And I think that's important to get out there is like, it is muddy. I think especially with complex trauma and autism and ADHD, it's really muddy and it's really hard. And as clinicians, we're not always going to get it right because these things are incredibly, incredibly complex.
I would love to hear from more of a practitioner framework. And not so much on the assessing side, but just on the, counseling or therapy side. What are some of the things that you were taught in your training programs that now you look back and you're like, ooh, that was bad. I shouldn't do that. What are some of the things that have kind of shifted for you in that way?
Honestly, I didn't get a lot of education around autism or ADHD. So there wasn't like a ton I was taught that I had to unlearn because I just wasn't taught much about it. I think the message around autism was definitely like, if you want to work with autism, you have to go on and do 5 years of training beyond your doctorate. So I think that's one thing I've had to correct is if you are a licensed provider and if you're in a state where, because different states have different laws around master's versus doctorate and who can diagnose neurodevelopmental conditions. But if you're in a state where you are licensed to diagnose these things, I think as a clinician, you should be comfortable diagnosing it. It makes no sense to me that clinicians are comfortable diagnosing personality disorders, but not autism. So I think that would be one thing of just that if you're getting a degree and you are diagnosing these other conditions, you should be comfortable also assessing for and diagnosing autism and ADHD. And maybe this is too much in the weeds, but I don't mean like a standalone assessment, diagnosis as course of treatment. So like if you're working ongoing with someone and you're trying to sort out what's going on here. So that was one thing I had to unlearn, was that I can diagnose autism as course of treatment, that's part of what the clinical picture we're looking at.
Right.
And then I just think how I hold and how I think about autism and ADHD is very different than how I was trained in shifting it more from a medical diagnosis to an identity. So yeah, the way I hold the diagnosis is very, very different than how I was trained. I wasn't trained at all in things like sensory perception and interoception. So, and those are things that I think are really important for neurodivergent individuals to understand about themselves. And it very much taps into how they regulate emotions. So the approach to even any conversation about emotion regulation, I've kind of backward engineered it to we've got to start with the sensory, and we've got to start with things like interoception. So those would be a few examples, but I think the biggest difference is just how I think about and hold space for the neurodivergent identity versus a medical condition that we are pathologizing and treating.
Breaking down the stigma and misconceptions about neurodivergence is just this really long-term ongoing process. What are some of the ways that you do see people working to break down incorrect beliefs? And do you feel like things are changing?
You know, it's so hard to say, Emily. Like, I'm very aware of how society is set up now. I think we all kind of live in our little echo chambers because the algorithm tailors information to us. So in my little echo chambers, it feels like the world is changing, but then sometimes I go back out to more mainstream spaces and I'm hearing the old stuff. I do feel encouraged. I feel like even since I graduated, when was it, like 3 or 4 years ago, I feel like there's been a big shift. It's slow moving work, but I do see it happening. But again, I think we're all so influenced by our echo chambers, it's hard to really tell. And that some pockets of the world are changing more quickly than other pockets of the world.
I do a lot of work in a variety of different environments. I work with businesses in the workplace, and I work in the field of education. And it's fascinating to me, sometimes the workplaces and the businesses are a bit quicker to go, yep, let's do this, let's change it. Whereas in the education world, it's so slow because some of the things that we've done, like the behaviorism and, teaching to the middle and not really focusing on kids who are outliers and trying to focus on, for lack of a better way to phrase it, making kids look normal. It's slow there. And again, you have these little pockets or these little voices. If you were talking to somebody who was just trying to figure out like what steps they could take to try to communicate this, to try to advocate, whether it's for themselves or for a coworker or a child, what sorts of things would you suggest?
Okay, I'm trying to do the top-down thinking thing.
Yeah.
I think I'd like addressing myths. Like, there's a lot of myths that are still out there. So things like autistic people can't have empathy.
Right.
Autistic people don't have emotions. Like, there's still these really terrible, horrible myths out there. I think part of the change is more people being visibly autistic. And that takes privilege because that takes risk.
Totally.
So one of the reasons I came out as an autistic psychologist was because there aren't many of us. There aren't many of us who are visible because it's a very hard profession to be visibly autistic in. And I think Devin Price talks about this in Unmasking Autism, how being visibly autistic is an act of advocacy.
Yeah.
So I think the more we see, like the medical community, that's a community that's actually very autistic, but it's so hard. Like medical providers, it is so hard to be out in that community. So that's one thing, is being visibly autistic if it is safe to do so. And then anyone, if it's an ally or not, can also help with just when you hear some of these myths, debunking them or positive representation of neurodivergent people.
Yeah.
Those are a few top-down thoughts that come to my mind. But yeah, I am better at the bottom up when I have a specific context I'm speaking to.
Yes, I totally get it. I want to touch also on an area of interest that you have because you're currently working on a book on autistic burnout. So talk a little bit about what autistic burnout is and why is it important for us to have an awareness of it?
Yeah, so really, Dora Raymaker and their research team, they did a study, I believe it was back in 2021. And autistic burnout it's been talked about in the autistic community for a long time.
Mm-hmm.
And then they were the first one to like, okay, let's do a study here. Let's kind of get some science behind it. And what they found in their study is that the key features of autistic burnout is increase in sensory sensitivities, which we know for a lot of us have a baseline of that, but that those tend to get worse in burnout. That chronic fatigue, which is felt in the body, emotional fatigue, cognitive fatigue, and then a loss of skills, which it's not affirming language, so it's not language I use, but in kind of classic autism world, you hear a lot about like regression of skills, like in children. And it's interesting to like reimagine that through the framework of burnout of like, I wonder how much of that is connected to burnout. So that it does share a lot with, burnout in general has been talked about in the world at large ever since the pandemic, because a lot of people are experiencing it, which burnout can be thought of as like a burnout of the nervous system when we are just completely depleted. I think for autistic people, what is difficult about autistic burnout is that I don't love the word typical, but kind of living the typical setup of life often doesn't work for us and will drive many of us to burnout. And so I think a lot of times it takes a pretty massive restructuring of life and building a different relationship to work and environment to build a life where we're constantly not just in burnout, recovering from burnout. And again, that takes a lot of privilege to do so. So many of these conversations, we can't have them without also having the conversation of how it intersects with privilege.
Yeah. We talk about unmasking and being authentic and recognizing the fact that based on what other intersectionalities of identity a person experiences, it really is a privilege. Not just from a psychological safety, but from a physical safety.
Yes.
It may not be safe to openly stim.
Yes.
It may not be safe to communicate in a way that feels more authentic, like if you're not masking. And I think it's really important for us to bring that up as we are talking about it, because as white women, we have that privilege.
Absolutely. Yeah. I actually made an infographic a couple years ago, and I had one that went out like the week before, the cost of masking. And the next one was the privileges of masking. Oh my goodness, I got so much hate on social media, mostly, frankly, from people with privilege. And it was a really interesting moment of like realizing the autism world, again, it's our echo chambers. Like I'm pretty plugged into the intersectional advocates, but realizing autism advocacy space really doesn't understand the nuances of we are having very different autistic experiences. The backlash I got for that infographic taught me a lot and was pretty discouraging.
That's interesting. I have thoughts about that, but I'm not sure how to put them into words.
I can see your brain working in that way of like, there's a lot of thoughts. This is also a really sensitive topic.
Yeah.
Do I want to go there? And if so, how do I put this together in a way that feels good?
Yeah. I think sometimes we have to question ourselves. And if we don't, we're doing a disservice. I just had the opportunity, and we mentioned that I do this background with a lot of twice exceptional learners and had the opportunity to go and work with Detroit Public Schools and talk about they're developing some programs for their gifted learners and twice exceptionality. And it's like the conversation about unmasking is very different when you're in a community, first of all, with a ton of trauma.
Yeah.
For example, in the school, you see a little white boy who gets really upset about something and throws a chair. And it's like, oh no, he's autistic. But if it's a black boy, oh, well, that's a conduct disorder.
Yep. It's behavioral.
It's just another piece of the puzzle.
And that's another, like back to kind of education and awareness, that's another one that I hope to see changing, and I think maybe is slowly changing, but that bias, that back to like the idea that to some extent, these diagnoses are social constructs. That's one of the biases that creeps in. There's a lot of statistics to show Black and brown children are much more likely to get diagnosed with oppositional defiant disorder and conduct disorders than ADHD.
This has been an awesome conversation, and it went in a lot of different directions that I maybe wasn't expecting, but I think are good. I'm really grateful for your time today. It brings me to our last question. If you were talking to someone who fits into some of that non-stereotypical representation of neurodivergence, and they're just really starting to try to figure out how to understand this new part of themselves, this new identity that they're now coming to terms with, is there anything that you would tell them? Is there anything specific that you would want them to hear?
That's a really good question. The first thing that popped in my head is like, you make sense. Like, you and your experience, you make sense. And that there's a community of people who also like get you and will get you. So I think validating that who they are and their experiences make sense, and that they do have a community of people that will get them.
Dr. Megan Anna Neff, co-host of the Divergent Conversations podcast, thanks so much for being here today.
Thank you so much for having me. It's been a pleasure to talk with you.
There are so many segments of our lives where we're likely to get stuck in our little bubbles of like-minded people. I mean, who wants to deal with the discomfort of talking about something that other people don't understand or don't see as valuable? But ultimately, when we talk about advocacy and changing the world around us, part of that has to be about showing up in spaces in ways that bring awareness to topics that maybe aren't part of the conversations already. Earlier this week, I was presenting to a business about neurodiversity-affirming workplaces, and the folks who coordinated this event suggested having a panel event where neurodivergent employees could share their experiences. It was the first time I facilitated a conversation for this type of audience, but by the end of it, I could tell that the sharing of lived experiences by their coworkers was more impactful than any direct presentation I could have given. I realize how risky this can be for folks, but it's also what makes it so incredibly powerful. I'm Emily Kircher-Morris. I'll see you next time on the Neurodiversity Podcast.
To find more information about Megan Anna Neff, look no further than our show notes. There are links there that will take you where you need to go. Also look for the link to our Facebook group where we continue the discussions and start new ones as well. It's a friendly neighborhood, and we can always use more members. We hope to see you there. Our host is Emily Kircher-Morris. Our music is from Epidemic Sound. Find us on social media via links in the show notes and on our website, neurodiversitypodcast.com. I'm the executive producer, Dave Morris. For all of us here, thank you so much for listening, and we will see you next time. This is a service of the Neurodiversity Alliance.